93.2%. 240,735,600. That's how many Americans are metabolically unhealthy, according to a recent study by the American Journal of Cardiology. 122 million women, 118 million men. That's right, 90% of the people around you are metabolically unhealthy. That's our friends, our family, our coworkers. Maybe you're the lucky 1 in 10. That means you're going to be watching them decline in health over time, and maybe you already are. Is it any wonder why we're unhealthy? It takes about 1 second on the internet for us to get hit with something that we should or shouldn't do. This article says we need to work out more than we're told. Well, that sounds awful. The second article says, hey, look, we need to eat more chocolate to solve hypertension. Ooh, that sounds yummy. Chocolatier diet. It's plant-based, and we know that's healthy, right? Or wait a minute, plant-based is full of carbs, and carbs are so damn complex. But my favorite article in debate is alcohol. Drink a day keeps the doctor away. Now that's something I can get on board with. I mean, some people call drinking every day alcoholism, but let's do it. Who's in it for Sunday fun day? Or wait a minute, just 2 weeks later, 5 drinks a week, wait, isn't there 7 days in a week? Now causes DNA damage. Oh, we'll just make the week 5 days now, right? Look, I get it. This was me in 2016. I was a successful executive at the leading digital health company in the world. I was bringing transformative initiatives of connected care to millions of people around the globe. Yet despite my focus on health, I saw my own personal health decline. I was gaining weight, afternoon headaches, lower libido, yet I thought I was doing everything right. I was working out all the time, organic, gluten-free, yet everything I was doing wasn't working. And all of my objective metabolic markers were going in the wrong direction. Went to my primary care, left me with no answers. Was I low T like those guys on that commercial? Was I just getting older? I was left in a world of trial and error, all errors, with nowhere to go. Luckily, my wife happened to be studying the approach of integrative health. Integrative health, aka functional medicine, holistic health, takes an individualized, whole person view as each person is a unique metabolic state. It's done through advanced metabolic testing, self-assessments, and personalized health recommendations. Through that process, not only did I have a transformative change in my health and life trajectory, I quickly lost 40 pounds. I now feel healthier and more energetic in my 40s than I did in my 20s. So what's the deal? Why doesn't everybody have this level of insight, right? Well, in the debate about healthcare access, in the debate about healthcare and our declining health, we often hear the term healthcare access. So let's break it down. If doctor knows best, there's approximately 118,000 primary care physicians in the US. We already know there's 240 million unhealthy adults. If we work them 40 hours a week, 52 weeks a year, I mean, they might want a bio break, a day off, or even a vacation, but let's just plan they're working for us. Everyone would get exactly 61.2 minutes. 1 hour. 1 hour to fix everything that's going on with each one of us individually. Oh yeah, doesn't count anything like broken bones, chronic pain, the occasional global respiratory pandemic, right? So what we have here is an impossible situation. If we look at it just through the lens of healthcare access, even if everybody had access to a physician, there's not enough time to truly get to the root of what our health problem is. So now's the time to start thinking about the problem in a new way and starting to put our own health in our own hands. So, how do we get healthy? There's one dependable rule about your health, and that rule is, it depends. Depends on your genetics, depends on your diet, depends on your lifestyle. The only rule about your health is that it depends. So what can you do in 60 minutes when everything about your health depends, right? So what we need to do is think about approaching the problem in a new way. I believe that our solution lies in the power of health intelligence. Health intelligence is the accumulation of billions of data points into a common system to fully unlock what's going on with you as a metabolic individual. Through health intelligence, truly personalized, proactive healthcare can be achieved at lower cost and better outcomes to society as a whole. Reducing wasted spend, capturing money that's already being spent on fads or diets that just won't work. Health intelligence allows you to prevent the onset of chronic disease and really take back control of your health. Previously, we've always thought of doctor knows best because they indeed were the experts. However, in the last 50 years, the practice of medicine has not changed. Yet, the technology to access the healthcare information has exploded. That allows us to become our own best doctors. So through that process, we're now able to really understand each of ourselves individually. A simple search using the information machine in your pocket, using, lecture on healthy lifestyle, will return approximately 9.9 million results. Now, do I expect you to click all the links? No. Well, you got past page 1? Probably not. The reality is, you have the access to the information to really, truly understand who you are and what to do about it. And what to do about it, sorry. And we each need to understand ourselves as a metabolic individual. When was the last time you had your blood work done? Was that because you asked for it? Or was that because your physician said, I guess we need to run your annual blood work, right? The tide is changing. So why now? You now have access to broad-based metabolic testing through consumer channels. Now you have the opportunity to truly understand your health and what drives it. The consumer health and wellness market is over $4 trillion and growing at 10% year on year. 1 in 3 Americans is already using an integrative health practitioner. Google searches for integrative health have grown by 5,000%. According to a recent CVS survey, 85% of consumers believe that personalized care is important, and 83% of consumers want their provider to understand their genetics, family history, or other lifestyle factors that may impact their health. So now is the time to truly reach out and find a practitioner who can help you understand yourself individually and get to your own root cause. A new healthcare system of the future is now emerging. That system is rooted in your health intelligence, your practitioner, and your advocacy. So now that we know what the future looks like, where do we start? The first thing to understand is that health transformation is a journey, and you're going to continuously improve over time as you move through the pathway along your process. So now let's start with the framework. The first thing to fully start with is assessment. What's your honest assessment of yourself and where you're at today, right? Then track yourself. Give yourself a starting point. So for example, you look like you work out quite a bit. Exercise, probably not a priority. Maybe you're a shift worker. Now you need to start focusing on sleep, your sleep environment and your sleep quality. Assess, track, change, and measure. And the process continues with each step along your own individual journey along your pathway to optimal health. When we shift the conversation from our physicians asking us about our health to us asking our provider about what we're struggling with, what we're working through, what we need help with, we'll finally see the outcomes that we're looking for. Look, you're not going to become an expert overnight, but we have to invest the time to truly enhance our health IQ to really get where we want to go. So let's start with 5 things. The first thing, 1, the healthcare system is not your answer. Your health intelligence is. Second, it all starts with you, and it's okay to start small. Third, we have to invest in understanding our own health IQ. Fourth, we need to seek out practitioners that are going to help us understand our own root causes and what drives it. And finally, we need to recognize that we're spending money on this already. Now is the time to spend the money in the right way for the outcomes that we all want as intelligent health consumers. Look, your best doctor is sitting in the room with you right now, and it's you. No one is gonna know you better than you know yourself. Would you rather have a doctor that spends 60 minutes with you a year, or a doctor that's with you 24 hours a day, 7 days a week, 52 weeks a year? We were all born with our health, and we slowly give it up across our lifetime. Until now, we keep waiting for somebody to give it back to us, but the reality is the only person that can give it back to us is ourselves. And now with health intelligence, we can do that. There's two commodities that each of us have: health and time. We can't control time, we can control our health. If we don't invest the time to improving our health, those two commodities will collide and we'll be out of our health and reach the end of our time.